we also have a situation whereby we have a lot of elderly people dying because there isn't enough money to take care of them. Now, even those that have mental illnesses, some are not even able to buy their drugs. The drugs have now become so expensive. So you discover that you now have a lot of people having mental illness from various quarters. And somehow the harsh economic realities have contributed to these people suffering these different types of mental illnesses.
All right. Now, I want to ask a question. I want to believe people come to the University of Port Harcourt Teaching Hospital, to ask questions or to take counseling and all of that, in terms of mental health situations or state or illnesses. Has that number increased in the last few days, weeks, years? What's your take on that?
I'd say the number has increased in the last couple of months. Yeah. The number of patients we've had have increased. And then again, there's now better awareness.
Okay.
Of mental health issues. Initially, most people didn't even know that they had a mental illness or they had any form of mental problem. But then, now people have become more aware of the symptoms and signs of mental illnesses and are able to bring their relatives or come by themselves to the hospital to seek help.
So you mentioned the different mental health illnesses or sicknesses. Which one is more prevalent in this time that we are having economic disruption, so to say? Depression. How can one know when one is depressed? Like now, the story of the 32-year-old lady who, one would say, oh, she's working for a bank, so she's probably doing very well. She probably has everything going. There are people losing jobs because companies are leaving the country. People can't afford, like you've mentioned, but she's working, so maybe, all things are fine. But however, she say, or before she died, she wrote a note and said the economic situation is something she cannot face and nothing seems to be working for her. So how can people be able to identify when there is a mental situation that they need to check?
Okay, I'll use depression as a case study. For depression, most of the time, these patients realize most days their mood is low. Whatever it is happening around them, their mood is usually low. Some of them also have low energy, are literally unable to get up from the bed to do anything, whilst quite a number of them lose interest in things that ordinarily would have given them pleasure. Some people who would have loved partying or watching ball or even going to church, you discover that they don't want to do them anymore. They just want to stay indoors, just lie on there, or they just want to stay by themselves. They're no longer interested in doing things that would usually give them pleasure. So these are the symptoms. You notice this, or when a family member or relative begins to notice this, then they should begin to ask questions and attempts to get this person to the hospital.
But this stuff you just mentioned, some would call it maturity. When you get mature, you outgrow certain things. How do we draw the line then?
Okay, for instance, someone has a job, a good paying job. I would rather lie down in bed. Now, that's maturity.
I agree with you now. We'll go for a quick commercial break. When we come back, I'll ask some more questions and then we'll open the phone line so people can join our conversation. Thank you once again. our mental health. I am Kalada Korubasibo, and this is Hard Facts in 92.3 Nigeria Info. With me on the show is a psychiatrist with the University of Port Harcourt Teaching Hospital. I'm talking about Dr. Valeria Offiah Ugwu. Welcome on the show once again.
Thank you.
All right, that sounds better now. So before we went on the break, you were telling us how we can identify it and how the situation has, caused a lot of people to go into depression. You said the prominent mental health issue right now is depression. You told us one way to identify it. What other way can we identify depression apart from not being excited by things that we used to be excited by? What other things can we use as some symptoms for depression?
Low mood.
Low mood.
Yeah.
Okay.
You find out the person is sad most of the time.
Mm-hmm.
And then you also notice some of them have this feeling of hopelessness about literally everything around them. Some of them begin to feel very guilty that they're the cause of whatever it is that is happening to them. You also have some people feeling worthless, like their life means nothing, like they are useless, they've never been able to achieve anything, they can't achieve anything. Some begin to hear voices telling them how useless they are, how they should just go die, they are not useful to anybody and stuff like that. So you discover that at the end of the day, if these symptoms are not tackled and looked into, you could discover that that person would maybe one day hear the voice tell them, go kill yourself, you're worthless, and the person would go kill themselves. I saw an article on the Punch that was studied in 2022 where it was noted that there were about 79 cases of suicide in Nigeria as of the year 2022. 79, and 70 of them were male. And then again, the highest number of cases of suicide was in Lagos. So basically, there's no way we can disassociate the harsh economic realities of the mental health illnesses, because one way or the other, they either contribute or even trigger the mental health illnesses.
So now, for the sake of the listeners, I would like to ask, how can one prepare himself or herself mentally given the reality? Because once again, the economic situation would not change overnight. It will take a while. So how can people get by mentally? Now, not financially. Now, we're not talking, how can we get by mentally to be able to survive? Because like you said, a lot of people are not sleeping. A lot of people, have taken to drinking, they're under the influence so as to get by their day. So how can we prepare ourselves mentally, especially in River State?
Okay. This is my own personal view.
Okay.
First,
planning. Okay.
You can't. This is 2024. You can't just dabble into 2024 and expect things to just happen. You get rude shocks everywhere. So you try to plan, and then in as much as you're planning, you also have to give yourself a check and a situation around you. Give yourself room to be able to feel and get back up. Don't put too much pressure on yourself and expect perfection, because most times, especially with the reality of situations around us, we can't really achieve perfection. But then you need to have a positive mindset, because if you're planning and you're already imagining that the plans are failed, you're already depressed before you've even started anything.
Dr. Ugwu, sorry to quote you short. I don't know if you're very much conversant with the times we are in. It's also been something has been happening for a while, and it has to do with how Nigerians compare themselves to the other. So this person has, bought this stuff. I also want to achieve what this person has achieved, right? And sometimes that's where the pressure coming. And when we were talking off air, when we went for the commercial, some people are doing 2, 3, 4 jobs. So the stress that comes, how then do you have a positive mind in all of these situations? Can you tell us, please?
First and foremost, everyone is here for a reason. You can't be the next person.
Okay.
We all have our different capacities. So instead of focusing on your weaknesses, you should try to look for your strengths and build on them. You can't be like Mr. A. Mr. B cannot be like Mr. C. But then Mr. A has innate strengths. There are things that you can do that can even fetch you money that are not as stressful as trying to do what Mr. B is doing.
Okay.
You get where I'm coming from?
Yes, I am.
So, first of all, you need to go back into your closet, assess your capacities, assess your skills. What can you do? Then plan based on what you have been able to find out. And go at your own pace. Don't pressure yourself. So a lot of people keep saying all fingers are not equal, but then they are right.
Let me paint a better picture for you.
Okay.
I like the picture you painted for me off air.
Okay.
You have a family to take care of. Like you said, children don't care whether going through whatever you're going through. All they know is they want to eat biscuits. They want to eat whatever they want to eat. You also have your wife. Maybe she's working, but you're the man, so you still provide some way or the other. You also need. You also would have to meet them emotionally after going through distress. So my point is, how then do you, in such a situation, you're trying your best, but how can you plan? Because you must already have a plan, but it's not working as it should, given the economic situation where you go today to buy a carton of Indomie, and by the next time you are at the supermarket, the carton of Indomie is twice the price. So I've painted a picture for you. How do you deal with that's the reality? A lot of people that's why this is called hard facts. We need to face the reality. So how do you survive such a situation? That's
actually the reality of life. So you have to keep adjusting to whatever situation you find yourself in. Now, some don't have the ability to adjust and adapt to different situations. Like, if Indomie is so expensive, must you eat Indomie in the house? You could find something else that could still make it happy, and they will not even remember you're not giving them Indomie anymore. Okay. So you need to find a way to make adjustments that would reduce the stress on you, reduce the stress on your family. If your children's school is several kilometers away from the house and you don't need to keep paying transport money or keep fueling your car to go pick them, it would be wise to consider changing their school to a school which is still affordable, good, and closer home, so that the pressure reduces. Because the truth is that the more we put so much pressure on ourselves, at the end of the day, the children will still be the ones to suffer. So we owe it to ourselves and to our children to be healthy.
Yes, we do. Yes, we do. Now, I want to ask, what can the person do to, get it? It's not a clinical stage. I'm believing. What can a person do, to be able to get out of it?
I would still advise that the person comes to the hospital.
Okay.
Now, the fact that the person comes to the hospital doesn't necessarily mean that the person must be given drugs. It depends on the assessment done on this individual. If assessment is done and the individual's level of depression is not, because we have mild, we have moderate, severe. So if the person's level of depression is at the mild stage, it could just be psychotherapy. Even some moderate depression, psychotherapy can do the job. Well, some need to add maybe a little bit of antidepressants for the person. But then it's the severe ones that we need to admit and go through the pharmacological as well as pharmacological treatment for the individual. So I would still recommend that if people begin to notice the symptoms of depression, let them go to the hospital.
Do you think that culture, common therapy?
That's what we're hoping people will begin to develop, because it helps us prevent a lot of things that would have gone wrong.
What are some of the things that can go wrong?
They could move from being mildly depressed to being moderately depressed to being severely depressed and probably committing suicide.
Okay, apart from suicide, what else? What else can go wrong?
Apart from suicide, you could find someone that would not be able to do anything, not be able to function at all. You just find them lying down,
not being productive. I guess that's how to best describe it. My goodness, if I want to come in for therapy, because now listen to you, it looks like I need therapy. If I should come in for therapy, what's the process like? Do I have to pay for it? Do you just sit with me and gist? And what is it like?
Well, if you have to come for therapy first, you would first come to the hospital, come through GOPD, the general outpatient unit, then they refer you to the psychiatry department. Then when you come, you get to see a psychiatrist who will assess you. Now, after the assessment, you can now be directed either to go for psychotherapy or to receive some drugs before you go for your psychotherapy, depending on what is found. Sometimes it might not even be depression that is happening to that person. It might be something else. It might be something we call schizoaffective disorder. So it might be beyond just depression. So after the assessment, the psychiatrist can now direct you to the psychotherapist. Also recommend medications for you.
All right. Oh my!
Wait for them.
I'm waiting for that. Okay,
Yes,
so I know you're listening. I always ask if. I don't know why I have too many ifs in my pockets. But let's continue listening right now. Yes, we know the economy is not at a very stable state. We've talked about it a plethora of times, like I already mentioned. And so we're not necessarily looking at the economy because I know some of you already know the statistics. If I show you what is, inflation, if you were an exam, you pass because I, reeled it out 1,000 times. If I should ask you what's the cost of a basin of Gary, a lot of you know the price because you just left the market. And a lot of you are now calculating because this is January and January is usually the longest month of the year. And I get that part. However, I'm also aware that it is affecting a lot of mental health in the country. A lot of people are finding it hard to get by. Even me, I know I can smile with you every day, but yeah, I feel it too. Sometimes I don't even want to come to work. I have to show up. So I like to get your thoughts. If you have a question for my guest, I like to hear your questions as well. So maybe we can provide you with the answers. But what is on your mind right now? How do you think the economy has affected your mental health? Looking back, when things were a little bit better and looking at it now, how would you describe, the mental situation or the mental health situation in your family? Your wife, you, your siblings, your parents, whichever the case, whatever the relationship. It could be even a love relationship, what you guys call it these days, boyfriend, girlfriend, yeah. It could be that as well. But let's get your thoughts. 0817, yes, the phone lines are working now. 0817-923-0002 and 0817-923-0003. The other number to call me with is 0817-923-0007. For WhatsApp, use the number 0809-0306-416. Remember, we're live on Facebook, Nigeria Info PH. We're live on YouTube, Nigeria Info PH, and we act next, Nigeria Info PH. Now, let's read some wonderful messages on WhatsApp. This one says, ask the doctor if people get easily agitated, irritated, and unduly aggressive if there are signs of mental illness. And then you said, ask the doctor if assisted suicide is considered by her as a way out of the problem of this world. And what about God's factor in all of this? DK, are we going spiritual with this? But let's get your thoughts, Dr. Ugwu. What would you say on that one?
Okay, first, irritability is also a sign that something is going wrong. It could occur in depression, it could occur in mania, which is another form of mental health illness. Some people have what we call bipolar, where they could either come up with the mania aspect of it or sometimes the depressive aspect of it. And then sometimes they have like both alternating in very short intervals, at about the same period. So yes, for people that get very easily aggressive, but then again, there are some people that abuse substances.
Yeah.
Now, those that abuse substances also tend to come up with some of those traits, some of those character displays of aggressiveness and irritability.
Okay, so I think
he said something about assisted suicide.
Yeah. Do you think we should skip that? Do you want to answer?
No, I think you should skip that.
All right. This one says, great topic, even greater insight from the good doctor. But please allow me to add that apart from the economy, Government utility services have added a greater and already deteriorating situation. You come home from work and wish to settle down to the comfort of your home, but where is the power supply to power your electronic gadgets such as fan, air conditioner, TV, etc.? We all know the pump price of petrol is almost above the reach of the common man. But this is what pains me the most. Those whose jobs it is to make life easy for us are having a ball, fiddling away on their violins while we burn. Is there hope inside? Whatever happens, whatever happens, society is not an option. They lie to you when they say it is the easy way out. It isn't. Stay strong, people. Hope springs eternal. Newton Ikire. Very poetic there.
Yeah.
Thank you very much for that one. Let's take some calls now. Let's find out what you have to say. Hello, what's your name? Where are you calling in from?
Hello, good evening, Canada.
Yeah, welcome. Good afternoon, welcome.
Good afternoon. This is Victor calling from Andon.
All right, Victor from Andon, welcome.
No, good luck.
Oh, good luck. Sorry, it was noisy at some point. So good luck, welcome. What's on your mind?
Now, this show is visiting hospital. So, us here in the rural area, I don't know. Let me not say that there is no such, but I don't know if your guests can enlighten us. If there's this department, we will call it the psychiatry department in our modern primary health centers. Yes. So as far as I'm concerned, I think that's a standard place that we can go for such a medication like such checkup and the rest.
Okay.
So is there such department or what do they intend to do? Because we don't expect us or expect everybody to be able to pay their transportation down to accord with the cost of transportation and the rest. And the next thing I want to talk about is this problem I do have. I don't know if I can say is also that if we can subject it to such, like I have missed sleep in the night. If they said I take some drugs, and I find it very difficult to like if I could eat, maybe I would just manage to take some stuff in the day, and that's all for the day. And it appears as if nothing at all makes me happy. Like I somehow feel restless, like I should just be going from one place to the other. Like I just feel like seeing faces. Just I don't really know what to say about this. So I don't know, and what should I do about this?
All right.
To get myself my normal fit.
All right.
Finally, I want to appeal to you. Please, there's one program. This issue of our economy is really affecting our family, the family setting. But this program, your sister station, Valeria FM, did. I think the person that anchored that program is Mary Kay. I really don't like it because
you can't report. You can't do that on the show. But thank you very much. I was waiting to hear what you had to say. But reporting my colleague on the show is not the way to go. Hello, welcome.
Good afternoon, Canada.
Yeah, good afternoon to you. Welcome. What is on your mind, please?
Ezekiel, calling from.
Welcome, Ezekiel.
And greetings to your guest there in the studio.
Okay. I'm listening to you, Ezekiel. Are you there? Can you hear me? But I can hear you loud and clear. All right, call back if you can. 0817-923-0002, 0817-923-0003, and 0817-923-0007. I'll come back to you. Just give me a few minutes.
Good afternoon to you, Canada.
Yeah, good afternoon to you. Welcome.
Thank you very much. I'm Pastor Marcos, calling from Bari City in Ogoniland.
All right, welcome.
Good to you, Doc, in the studio here.
Greetings here.
Well, yeah, thank you very much. I really want to commend the work you're doing. Right from when I was listening to your lectures, oh my God, it was really something else. Now we're talking about depression. Looking at the economic situations of nowadays, now we Christians, we look at in the area that we hand everything over to God. That's only what we can advise everybody.
Okay.
But I want to say thank you because you're doing a great job. Looking at what people are passing through, looking at the anxiety, the pains, the worries, the depression, what people are going through. It's a high time we need topics like this. We need to hear things like this. We need to console people like this. My God, the Lord will help you so much. Thank you very much, Kalada.
All right.
More good to you. Doctor, thank you very much. Thank
You're
you. God bless
welcome.
you.
All right. Thank you very much.
You.
Thank you very much. Okay. Hello. Welcome.
I called again. This is Ken. I'm calling from Ugwu.
All right. Can I share your thoughts, please?
You said a 32-year-old banker committed suicide, right?
32-year-old lady who is a banker, yeah?
That's the third one. For me, in my own opinion, I think if others who don't have anything to do that, I don't think is the reality of the state now, the state of the nation now, can lead her to such act. It may be something psychological.
So you're saying the economy is not bad enough to affect someone's psychological state?
That is based on the condition we heard from her. I don't think he really feels that he is affecting her, because there are many people out there that she is more better off.
Okay. I get your point.
It should be spiritual, or it should be psychologically affecting her that led her to commit such things. But that is right there. Actually, I think that the reality of the state of our nation now is the very thing that may cost to whatever thing that may happen to somebody. But in other words, I can also say that psychologically, things happening around one can also lead somebody to think or overreact. But I have a question to your guest there in the studio. Can aggressive irritation associate with mental health?
I think we answered that already. Yes, yes is the answer. All right.
That is one.
I've got to go. I'm sorry, as it can. There's not enough time. I have questions, and some of you have questions as well. But do you agree with him that because she's doing better? I asked you that question earlier because she's seen as doing better than a lot of people. I mean, unemployment is high in the country. Some people don't have jobs, but she does have a job, and she still is being affected psychologically, or was affected psychologically. He's saying it shouldn't have been the case. Do you agree with that one?
The thing is, we don't know all the circumstances around this particular woman.
Mm-hmm.
All we've heard is that she committed a suicide. She dropped a note stating the economic reality is contributing or single. We don't know if she had an issue in her relationship, which also, contributed to how hopeless she felt. Because usually before they get to that stage of suicide, except for those that hear voices telling them to go do it, they would have become really, really hopeless. And some of them begin to feel really worthless before they get to the extent of, contemplating suicide. Except for those that hear voices that tell them to go do it. Okay, so where I'm coming from is this: we don't have the facts concerning this particular individual. So I think for now.
But yeah, I agree with you on that one. But do you think we talked about it not so long ago. The economic reality can push people to the wall as well.
Yes, it can. But then again, it's not like it directly does that. It somehow affects
every other thing.
The relationships. It affects literally everything. Some people can't even access health when they want to get health, because when they seek help from the hospital, because they don't have the money to do this. Some people can't send their children to school, because the economic reality affects every aspect of our lives. So maybe one of those aspects was now so much for her and she couldn't bear it. Sometimes it's even in the relationship. Some people want to get married today. When they look at the list or the cost of things in the market, and then they are like, how are they going to run their wedding, their traditional marriage, their stuff? Some men are now developing cold feet. They don't even want to.
Okay. So someone asked a question not so long ago, talking about psychiatrist or is it psychiatric hospitals in
The
rural areas? As a doctor, do you know of any psychiatric hospital in the rural area? How many do we even have in the city, in the urban areas?
I just know of Ugwu and UPTH for River States.
In its entirety?
In its entirety. I don't know of any other psychiatry hospital or where you can access psychiatric services except for some private hospitals or private psychiatry hospitals. Then basically what we have is UPTH, Ugwu.
He said he can't sleep.
Yeah, that's one. Now, not being able to, but he mentioned something. He said something about being restless.
Yeah, we'll get back to you. Let's go for another quick commercial, then we'll have your final words for that one.
Okay.
Yeah. All right, we just have 3 minutes left and the phone lines are still beeping. I'm seeing messages dropping on WhatsApp. I mean, I want to take all of it, but there is not enough time. So I'm going to tell the doc in the studio that she'll come back sometime in the future to help us, with this conversation. However, we're talking about being restless and not being able to sleep. One of the callers mentioned that.
Yes. Usually those are signs of anxiety. He definitely has a lot of things he's worrying about at night. That makes it difficult for him to sleep, and then he becomes restless. Some even develop what we call palpitations. They begin to feel their heartbeats, Quite a number of them are unable to sleep, like he also mentioned. Some of them even begin to feel this what we call chest tightness, like they're not getting in enough air into their chest. Some of them also have low mood, So it's like a variety of things. There's a lot of physical symptoms. Some feel like there's a heaviness in the head, like the head is just really heavy, and they're not really able to function like they would like to. I think he should come to the hospital.
But he says he stays very far. It's far off from UPTH, so I don't know how.
But he's in River State.
Yes, he is.
So he's not traveling.
So he should come to the hospital.
He should come to the hospital.
All right.
It doesn't mean that he'll be told to come every day. When he's seen and assessment is made and he's placed on the appropriate medications, he can be given a long-term appointment subsequently. So it doesn't mean that he's coming every day to the hospital. He should just sacrifice the time to come.
All right, then that's where we step on the break for the now, because the news update is up next. However, I do think what I've gleaned on the show is that a lot of us are anxious, a lot of us may be depressed. We would not know if we do not go for a checkup. So yeah, make it a date with the doctor, I guess. I am Kalada Gorubatubo. Thank you for listening to my pep talk.